Okay, I am back and I'm going to finish up the material that I did not get to cover in class last week. I'm going to break this up in small casts so it's not too boring and you can watch a little bit at a time. The first subject I'm going to talk about is bacterial meningitis, or meningitis in general. What you need to know is that bacterial meningitis can range from, I'm not going to say mild because these kids are very sick, but then there's the severe cases of bacterial meningitis, which is the ones you hear about in the news that typically are fatal. And it depends on the type of bacteria that is causing the meningitis. Clinical manifestations, these children will present with a fever, and they'll have signs of meningeal irritation, which include nausea, vomiting, irritability, anorexia, meaning lack of appetite, headache, and not just like my head hurts, a severe headache, photophobia, the lights hurt their eyes severely. They may have some confusion, back pain, and then nuchal rigidity. Nuchal rigidity is if you ask them to look down at the ground while they're standing, they can't. It hurts. If they try, it's excruciating, and if they are forced to look down quickly, they will fall to their knees. It's so painful. They'll have a history. They may have a history of an upper respiratory infection, which precedes these symptoms. Let's see. There's also the Kernig sign, which is if they are lying in a supine position, which is their back to the bed, hold their hip and knee at 90 degrees. They won't be able to extend the knee more than 135 degrees. So as their hip is pulled up and their knee is pulled up, they cannot straighten their leg so that it is going up into the air because it pulls on the hamstrings. Commonly, the most common causative agents for bacterial meningitis are Streptococcus pneumoniae, hence the respiratory infection, Neisseria meningitis, and this is the one that makes the news typically, Group B strep, Staphylococcus aureus, and E. coli. Neisseria is actually a very common bacteria. You can find it in your nasal passages, on your skin, but when it has access to meninges, to that vulnerable body, it can become deadly. Okay, so let's move on to the next slide. This is just to outline, in case you're wondering why are the meninges so important and why can it be so deadly? Well, the meninges are the layers that encase the brain, the spinal column. So you'll see this diagram here, and it lays out the layers and the spaces in between. Okay, and there's fluid in between each layer that helps to allow it to slip and slide. But if there's too much fluid or inflammation, it causes pressure, or if there's purulent fluid, it causes inflammation and irritation. You can see, being so close to the brain and the spinal column, just how painful that can be. So how is bacterial meningitis transmitted? Well, first off, it's transmitted by droplets. Sneezing, sharing each other's drinks. It's often seen in teenagers, especially the Neisseria, because they will share drinks or share food, or the crude way of saying it, swap spit with each other. And so it is transmitted through droplets. Oftentimes it can appear as a post or a secondary infection from another site. So a respiratory infection, pneumonia, can turn into a meningitis. Strep can also manifest as a meningitis if not thoroughly treated and eradicated. There is a seasonal trend for it. It is seen in the later winter and early spring. Okay. So how is bacterial meningitis managed? Well, first off, if a patient is presenting in a clinic or as an inpatient, they are placed in isolation, and they are placed in contact and droplet isolation. This means you put on your gown, your gloves, your mask, and if you're going to be close enough, you would wear goggles, because if they cough, sneeze, those droplets can get into your mucous membranes and can get into your eyes. So you do want to make sure that you are protecting yourself or anyone else that is around. And with that being said, it is not airborne, but it is droplet. So how are we going to manage it? We are going to, first it's going to be diagnosed, definitive diagnosis is a lumbar puncture. Cerebrospinal fluid should be clear. If it is not clear, if it is cloudy, it's a pretty safe bet that there is a meningitis and that it is most likely a bacterial. Viral can be present, and in that instance, the fluid may be clear. So put them on isolation. If it is bacterial, they're going to be on antimicrobial therapy. And until those cultures come back, they're going to put them on 2 different antibiotics. They're going to use an aerobic and an anaerobic type antibiotic until that culture and sensitivity comes back and tells them exactly what is the best antibiotic to eradicate it. You want to restrict hydration, and I know that goes against everything we've taught you about keep them hydrated, but in this instance, a big risk for these patients, the child with bacterial meningitis, is they're having inflammation of the meninges, and the meninges, when you become irritated, create more mucus, more output, and it creates pressure. It creates intracranial pressure, so you want to be very careful about overhydrating and increasing that intracranial pressure. With that being said, you want to monitor and prevent or provide maintenance for systemic shock, especially if it is a secondary type infection. The body's already fought one battle and lost, and now it's moved throughout the body to the cerebrospinal fluid. So that means there's multiple organ systems fighting this infection, in addition to the neurological. With increased intracranial pressure, there is going to be difficulty with respiratory effort. So maintenance of ventilation is going to be important, making sure that the effort and work to breathe is not too much. Because of the irritability of the meninges and that irritation to parts of the brain, there is the risk for seizures and an elevated temperature, more so than just the fever, because it can be a neurological temperature. So these are all things you want to take into consideration when you see a diagnosis of bacterial meningitis. These patients need to be monitored carefully and proactively treated. So non-bacterial meningitis, typically these are caused by viruses. Common viruses are the arbovirus, herpes simplex virus, cytomegalovirus, HIV virus, and the adenovirus. The diagnosis is based upon the cerebrospinal fluids that are obtained in a spinal puncture. The onset is either abrupt or gradual in a non-bacterial meningitis. And a bacterial, it is abrupt. Manifestations are going to include your headache, fever, malaise, In these patients, the treatment is primarily symptomatic. There is not as big of a risk of that systemic infection occurring or respiratory arrest. So encephalitis, while we're talking about neurological infections and inflammations, encephalitis is an inflammatory process of the central nervous system, and it causes altered function of the brain and spinal cord. There are a variety of causative organisms. Typically they are viral, and it's when there's a direct invasion of the central nervous system with a virus. Commonly, the virus is transmitted via a vector, so a mosquito, a tick, I'm trying to think what else, bites, fleas, they can transmit these viruses. A concern with an encephalitis is while the patient is very sick and there is inflammation of the brain, there is the possibility of a lasting injury to the brain from that viral disease. So it can end with possibility of seizures or loss of memory or ability. So that's always a concern. So how does encephalitis present? A general feeling of malaise, not feeling good, a fever, headache, dizziness, a stiff neck, nausea, vomiting, ataxia, which is where the body's not doing what you want it to do, and speech difficulties. It doesn't sound that different from a meningitis, although these patients aren't quite as sick as the meningitis patient is going to be. If it's a case of severe encephalitis, you're going to see that high fever, you're going to see stupor, seizures, you'll see spasticity of the muscles, and I've got some videos coming up in another section that shows you what spasticity is. Disorientation, they may go into a coma. Ocular palsies, so that is going to be jittering of the eyes. In other words, the eyes are twitching and they cannot control where they're focusing, and possible paralysis. So how are they going to treat encephalitis? Typically they will hospitalize the patient and observe them so that they are right there for treatment of symptoms. They will give supportive treatment. This isn't something you can just give an antibiotic for because it is viral. They will monitor for increased intracranial pressure. And then follow-up care and possibly rehabilitation if there's lasting effects to the central nervous system from that inflammation. In a very young child, there is a good possibility that they will have some kind of neurological disability. And that's all I'm going to say about the inflammatory or infectious disorders of the brain. Next section will be on cerebral palsy.